Hi everyone, today is the 23rd of June 2026. I'm here at my new GP, Ilford Medical Centre. As you know, since my last visit to St Thomas Hospital, they have told me to come back to my GP for further testing, as you know, if they'd done any testing there, they would have been exposed. So here I am. I've booked an appointment with them and they've told me to come in straight away, and fingers crossed I'll be able to get my blood tests and a MRI applicant Urology Referral, so we can get this looked into further. Alright, let's go in and see what they say.
And that's okay. What not wash it in the system because before
That's why it's not.
for tomorrow.
Can hear the week from here.
She needs to come here.
Tomorrow come at 12:30. And what's the date of birth?
9 March 1998.
What's the name?
Hiding your head. You want me to close the door?
Yes, please. Did you report to reception when you
I
come?
haven't yet, no.
You have to report to reception. They
Should I go back?
arrive you. I'll change that now. But anytime you come,
Mm-hmm.
we wouldn't know that you have arrived unless.
No,
you
there was
report to
someone
reception.
waiting, so there was someone already.
Okay, so I've arrived you now. If you just queue up, then they will register you.
Got it.
So is this your first visit to this clinic?
Yes,
When did you register?
I've just recently registered. It's been a month.
Okay.
More
Where
than a
were you
month.
before this?
Loxford Polyclinic.
Oh, okay, that's close by you. Do you live local?
Yes.
So you've had urine, blood in your urine in
Mhm.
November. Was you investigated at the time?
Yes. So I went to my GP, Loxford Polyclinic,
Mm-hmm.
after so many delays, after taking months for an MRI, a
Yeah.
blood test. What they've done is they've just kept me in a vicious cycle until they can literally make a person go insane, and it's not. They have completely wiped out my medical records from the NHS app since I've changed the GP.
What did you do?
And
Sorry.
They've wiped out my medical
They
record.
wiped it out.
So on my NHS app, I cannot see my
Oh,
previous consultations
okay.
or any other data.
Mm-hmm.
Right, it's been completely.
Okay.
And
So this was after you registered with them?
I've been registered with them for
No,
4
when
years.
did they stop the access to your records? While you were still
As-
with them,
no,
or after you?
I've switched over to Ilford Medical, and
Okay,
now
so
my
once
NHS
you
app.
move to a different practice, then that access will go off.
But
you
it
won't
shouldn't be
be
the
able to
case
access
because of with what
Yeah,
I'm suffering
it's-
with, what I've been battling with.
So when you move to a new practice, then you re-register, and then you get access back to your records.
Yes, I would
It's
like.
because
Yeah.
the way
If-
the
if-
system
if-
works.
If you can put in, I would like access back, so you are clued up with what I've been.
Yeah, if you just fill out a form at reception
Mhm.
to say you'd like to. So when you register, there will be an option there. But if you haven't got the access, then you fill out the form at reception. They'll do it. Okay, it automatically happens. You should be able to see it on
Mhm.
your record, on your app now. So when you had that blood in urine episode, what was the reason you went in for a check?
So I've been battling with a lot of issues where I've got pain in my organs internally,
Mm-hmm.
right? Mainly my liver and both kidneys, both sides at the back. And I've told them about it many times where, they keep coming back to me saying it's just a simple kidney cyst, it's a fatty liver, but things are much worse than that, right?
It's a fatty liver.
Fatty liver, simple kidney cyst, that has been their excuses which they have stuck with. And you know, I've stayed on top of it. I've done everything from my end, right? Reporting it to PALS, Health Ombudsman and everything. And what I've managed to expose is where the MRI systems of NHS have been hacked into to alter my MRI, right? To change it to show just a simple kidney cyst. But what I've been living with is much worse. So they can.
So where did
manipulate-
you have the MRI check?
I had it at King George Hospital. I've had ultrasounds of them, but they were all manipulated. I mean, it's just a massive cover up where they change your blood tests, ultrasounds, MRIs, and everything, and they can make up a fake cover up story or
Do
whatever.
you
it is.
remember when you had the MRI check?
It was in
February this year,
Feb 2026.
and it was done.
So after months of delays,
So it was requested by your GP.
I had to put in, you know, after the blood and urine in November
Yeah,
2025.
yeah.
It took me that long till Feb to get that MRI done,
Okay.
right? And even then, they did not prevent any medical fabrication. They did not prevent their system compromises, even though I warned them. I emailed. I've done everything. I've got the whole email trail, every single record.
So why would they fabricate, you think?
This is the thing. When they want to break down a person, they want to make them feel crazy for a lot of reasons. You know,
So
to
this
cover up the
4th
whole,
of February
to portray
MRI.
him as how, to portray me as how they want, right? Because of
So
what's
I'm
been done
just-
to me.
Yeah, looking at that report, liver, spleen not enlarged, gallbladder normal, pancreas normal, adrenal glands normal, kidneys are normal, left kidney has not shown any lesion, right upper pole, 19 millimeters cystic lesion without any thickening, suggests partial cyst, and no solid lesion, no lymph nodes in the background. You've got access to this report,
So,
I'm
yeah.
guessing, yeah? Blood
So
pools not
with the report that
thickened.
you're reading and the whole MRI
Yeah.
is a complete cover up, as a lie, right? So
Okay.
I've
What's
had
your evidence
I've-
to back that up?
I've had an MRI at a private place,
Okay.
Tick Health, right?
Where
where-
was it? When was it done?
It was in 2025. I can't remember the exact date.
Okay. Is it on your records?
I've shared everything with them, right?
Mm.
Where the radiologist himself, right, when I told him about my medical fabrication, what I'm going through that, you know,
Mm.
there's hackers manipulating the MRI ultrasound. He managed to find lymph nodes
Mhm.
on my legs. He said,
Okay.
right, that was one of the things he spotted. And you know, for the people who's behind this,
Mm.
what I've managed to find out is that to control people, they have these medical fabrication teams who can manipulate your blood test results, ultrasounds, MRI, CT, anything. And I've shared the evidence with Dr. Polyfit, I've shared it with PALS, Health Ombudsman, and they do nothing. They've kept me in that same vicious cycle
Okay.
where until the person breaks down, until he begs them for mercy or whoever it is, right? But I've stayed strong. I've continued battling the evil, and this is why I've switched over. So this is how I went to St. Thomas, right, to get a blood test or any help from there. Right?
Mm.
They didn't do anything, right? The only their excuse was the only thing they can do is a urine sample test. At a hospital, how can you only do a urine sample test, right? Right, when my body's breaking down, you can hear the noises coming out of my body.
So let me just get the facts right here. You've had this scan privately at Vital Health in June.
Tick Health, right?
It says Vital Radiology Service.
I've had many to stay on top of them.
So this is June 2025. This was before.
The Vital is like the radiology service, but the company is called Tick Health,
Okay.
right?
So this scan was done in June 2025, and the NHS one was done in February this year.
Yes.
Did you have any NHS scans before this scan?
Ultrasounds and you know
Ultrasound,
they,
not MRI.
they with the NHS they avoid doing these scans because they know, especially with me, they know what I've exposed and you know everything I've said is true, so it's a reality.
So today, what would you like me to do?
So you know, since me going to St. Thomas, then finding blood in urine, I would like a blood test done and a urgent MRI of the abdomen and pelvis.
Repeat again.
Yes.
Okay. Have you been to urology with your previous blood in the urine?
No. So the only thing they done was, you know, me continuously chasing them up for a MRI. But since November, it took them 3 months to do this MRI in Feb, and even then.
So you've
they
been to
did prevent-
urology clinic at Newham Hospital?
urology clinic, yes.
Yeah. Okay. So they were happy to discharge you back to your GP.
Because they don't listen. They go by reports that are manipulated, altered to portray me as however they want.
Why
until
don't
they
you
can
get me a
cover
urine
up.
sample first,
Sure.
and let's see what the urine today shows. I'll check the urine on the day.
Got
Is
it.
that okay?
But at the same time, would it be possible to do the urgent MRI referral?
Yeah.
And how will you want to proceed?
Yeah. Let's. I'll get you the book.
Perfect. Thank you.
Just knock on the door when you're done. That's the patient over there. Oh, I'll probably
Okay, I think that's-
Yeah, then keep it with you.
That's okay.
Just leave it here. So are you in pain today?
Yes, my back.
Why
Um,
do you take it on?
I just listen to music all the time just to block out any noise. So yeah, for me, I live in this pain and I have been for a very long time. Right, it's where internally it's my organs.
So for how long have you had these symptoms?
I've been battling them for a very long time.
When you say long time, is that 6 months or a year?
More, yeah, you can say a couple of years where they've only come back with a simple kidney cyst as an excuse.
So when you done the scan privately?
I've done many private scans, many scans with NHS, and they're just playing a very
Even the private team?
dirty, evil game where they want to stick with,
So even the private scans?
this is how they get away with murdering people. And I will share this with you because you will not understand it unless you are exposed to this reality, right? And as a medical professional, you have to make sure you are clued up on how they are getting away, and you'll see for yourself. I'll share the evidence with you. I can do it in details or over an email, but I'll show you a video so you can be clued up on how this
Have
works.
you ever had a camera in your bladder?
No. Right now, they need to own up to what was being done to me, my real accurate results, and my symptoms are severe. And for me, I'm planning to go to Istanbul for a detailed checkup. Obviously, it's gonna.
When are you traveling?
Fingers crossed, I can do this next month, and hopefully we'll see where it goes from there.
So, what do you do for work?
At the moment, I have managed to become a bus driver. I've got my PCV license. Managed to obtain that first, and then from there, I've survived long enough to expose this whole medical fabrication and everything as well.
So you're a bus driver at present.
Currently, yes.
Have you needed to take time off at work for any reason?
Not at the moment because I've just started this career. First was getting the license, and from there, I said I'm just enjoying the journey because it's like the best thing that's happening to me right now, especially with everything I've been through and what the NHS and the UK private health networks have done.
So, you're eating and drinking well?
Yes.
Sleep is okay?
Sleep is fine. Obviously, sometimes I do have issues, but it's okay.
Do you
I've
smoke
managed
or
it.
drink?
No.
No alcohol. Any burning or pain passing urine now?
I get penile pain.
When you pass urine or any time?
It has been happening continuously for a while. Like I said, since November, they have, just.
Okay. I'm just going to ask you some personal questions just because of the nature of symptoms you've come in with. You mentioned you noticed blood in the urine and you've got pain inside. Have you ever been for a sexual health check before?
What's that?
To check for any sexually transmitted infections.
They done it on what's it called? They have had my urine samples sent to the labs, and it's all come back clear.
Have you ever been to a sexual health clinic?
No.
Have you ever been told from your previous urine tests or checks that you had chlamydia or gonorrhea in the past? Have you ever been sexually active?
No.
Have you noticed any discharge from your penis?
No.
Any history of trauma?
Well, I'm traumatized by what
No.
they've been doing.
Where you've had the pain inside your penis, and because there's blood, I would normally ask if you've ever been involved in like a road traffic accident, or if you've had any trauma down below that may have started these symptoms or blood in the urine.
No. It's like I said, it's a massive cover up with how I've exposed medical fabrication very well. And
so from what you've mentioned to me today, I would need to have a quick feel of your tummy and check your lower back to check if there's any kidney pain. I will also need to check your temperature to see if you've got any active urine infection that may be giving you any symptoms related to a urine infection. When I dipped your urine, there's a very trace amount of blood in your urine. I will need to send the urine off to the lab, like you said previously, where they've checked for infections. Because this has been something that you've had in November and you've had it at the hospital you've been to in accident emergency, my plan would be to refer you to a clinic called Hematuria Clinic. So it's a clinic that has got blood in urine check that's done in there. And it's a fast track clinic. You usually get seen within 2 weeks. And they're the ones who will arrange all the investigations, whether it's imaging or camera tests, to investigate the source of this bleeding.
so this is the thing when it comes to, how they have kept me in this vicious cycle, going back here, going back and forth, right? You have no clue the hell I've been through, right? Okay. For now, what I want is an urgent blood test and an urgent MRI of the abdomen and pelvis, right? You can send it off to the lab.
Yeah.
And we'll leave it as that, whatever the lab comes back with.
Okay.
But these are the two things I want to prioritize, right? They need to give me my real scans, right? And you will hear my body on how much pain I'm in, right? I have to continuously support my back, right? I have to wear a chest strap to continuously.
Have you been checked for
survive
any
for
other
now.
causes of this pain?
No, like I
Like
said,
muscle pain or seeing a physiotherapist who
I
could
can't.
assess you?
It's first thing was where I could not do anything. Right, I could not um, afford to do anything. Now I've saved up enough to escape the evil environment they've kept me in, so I'm unable to continue doing the scans, keep up with what's being done to me, do them privately, do them with the NHS because of even the PALs, loopholes, the health ombudsman. They will not do anything to prevent. And let's say an old man comes to you, in your 60s, your parents or anyone, and they go through this medical fabrication process where there's someone playing games in the background, hiding the truth. He could suffer from a heart attack, he could suffer from any sort of conditions, and they are playing evil games behind the scenes. But I've managed to survive long enough to expose it, and I'll share a video with you, which you will eventually share with your whole team to know how this process actually works. It's like, them getting away with killing a lot of people throughout COVID, and then from there, the same evil continues, and they get away with it all the time.
Have you ever been under mental health team? The reason I ask that is because
Yeah,
it's
they have
noticed
offered
in
it to me many times,
Yeah.
but what I need is them preventing any medical fabrication of my blood tests, of my MRIs.
But
which-
you've not been seen by the mental health team?
They have offered it many times. I don't want to go. I can't. I don't have,
And what do you think is the reason they offered that service to you?
because
What did they
have done everything to make me go insane, to make me go crazy, but still I've survived to finish the evil and help others understand these realities.
Who else lives with you?
I live with my family, my parents and my siblings.
Are they aware of the...
They are not. I've not shared anything to keep them worried or give them any sort of stress. For me, I've done everything to document it myself and keep up with all the lies and everything.
Do you ever hear any voices or see things that you may not believe is
No.
true?
I'm spiritually very woke, where I know what's right and what's wrong. So it's just more of making sure that because the NHS knows how hackers can infiltrate systems and compromise MRIs and everything, but when it comes to hire people in the government and stuff doing this, then it becomes impossible for a victim to be able to do anything.
But why do you think your blood test results or images would have been hacked or fabricated?
Because of the chaos environment they've kept me in, right? It gets exposed where they have continuously lied about all my blood tests privately, all done with the NHS. So now, if they give it to me now, they will just be exposed.
So who is they?
Can't say. Like I said, I've done everything, documented it, and I've got all. Obviously, I'll share it with you. Have you got Google access to Google?
Yeah,
If you go watch this 1 minute thing,
Yeah.
you will see what I'm talking about, because right now you have never come across it, but after this you'll be enlightened with the realities that the things I've been through.
Now, what makes you believe that if I refer you for an MRI test today, that that result will not be fabricated?
That is their job, the NHS as a service, right?
But
to prevent
clearly,
it. If anything,
you have
they
not, if you believe all your previous results have been fabricated,
they have, yes.
how would you believe that this result is correct?
So I have complained to PALS,
Yeah.
right? I've complained to Health Ombudsman. I've
Mhm.
shared evidence with them
Mm-hmm.
on a very detailed evidence,
Yeah.
case studies from a news report, the only one that's out there on the internet.
So, no, this
A case
particular
study
MRI
from-
that I'm planning to,
Mhm.
that you're asking me to refer today, how do you know that that's not going to be tampered with?
So if NHS, right, NHS could have used my story as a case study where they prevent any medical fabrication of anyone compromising their systems to have my MRI to show just a simple kidney cyst or whatever, because they know what's been done to me and the severe organ damage that I've suffered, right, internally, and the people that have been getting away with it doing this, because they have medical fabrication teams.
Because I'm going to be referring you to NHS. If you don't trust that NHS is reporting correctly, accurately, there's no point in doing multiple MRI referrals, is it?
There is, because me as a victim, I have to keep up with them, right? You have seen blood in urine yourself, right?
Yeah.
And this is the best process going forward, right?
So there's a pathway that we follow if there's a blood in urine. We as GPs can't arrange specialist investigations, so we hand you over to the hematuria clinic, and they then take over, whether it's MRIs or scans or CTs, or if you need an investigation with a special contrast, or whether you need to go for camera tests, that team takes over. Because we as GPs, we won't be able to pick up if there's, say, God forbid, any cancer in the kidney or the bladder region. We don't have the resources to arrange those investigations here, and it's not just an MRI that will give an explanation to why you got blood in the urine.
So I'm fully aware of that. So the best thing...
So I will need to follow that procedure. If I request an MRI and the MRI reports whatever, but we still haven't got to the bottom of the blood in the urine, then that still needs to be investigated. So we are not resourced to arrange these tests and reassure you, or do these tests and give you an answer as to why you got blood in the urine.
So the best thing you can do for me as a GP is arrange a blood test.
The blood test is not a problem.
Right.
Yeah?
A thorough
But
blood test.
as far as investigating the blood in the urine is
Mhm.
concerned, I wouldn't be able to use the MRI just as one investigation. I will have to refer you to that pathway. Are you happy with that plan?
So we'll leave it to them, because I've reported this to the police. I've reported this
Okay.
I've done everything from my end.
So shall I just go ahead and do the referral
So
that
if-
we are meant to
if
do?
you can mark it down, it needs to be done urgently. Right?
So the referral that
Urgent
I do,
MRI.
no, the referral I do is an urgent, fast track, 2-week wait pathway that we use, and that team, when they see you within 2 weeks, will order all the necessary investigations, and they do that as an urgent as well.
Because last time it was marked as urgent, and since November I wait till February for
So
this MRI
The
to be done.
fallback for that with us is when we do the referral, if you haven't heard from the hematuria clinic within 2 weeks, you get in touch with us. So by the end of 2 weeks, so today is Tuesday, and you're looking at Tuesday in 2 weeks. If they haven't got in touch with you, you contact reception, and we'll chase them for you.
I've already been through with this process, and they take another 2 weeks after that, saying we don't have anything.
That's the best
and
we can do.
We have 2,000 patients waiting, blah blah blah.
Not for the
So
2 week wait
if
though.
you do put down urgent, right,
So-
on the paper, right, I will be able to chase them up myself, because I have the radiology number, and
So I'm not referring you to the urgent MRI. What I'm trying to tell you is I'm referring you to the urgent urology 2-week wait clinic, and they will contact you.
okay, so you're not going to give the urgent MRI referral from here.
I'm referring you to the team who will arrange it for you.
Okay, because last time I did manage to get a referral from the GP
Yeah.
directly,
Yeah.
but if you can do the same, that will speed up
So
the
I
process.
think we're going round in circles, Shirley. You have to understand, you've had MRIs that you're not happy with. There's no point in me adding that MRI again and not referring you for that 2-week wait clinic who will investigate this.
But they're going to do the same thing what you're doing.
Well, it's
because
up to them.
The thing for them
It's
is
up to them
avoiding.
what they need to decide.
Mhm.
Okay?
So how long it's taken me since I've been to St. Thomas, right? November was the first time. Since then,
So,
the same continued.
I
I've been
hear
there
you.
again, and then same thing.
I hear you. If I do that fast track referral to the team and leave it with them to investigate further, that's the best and the fastest pathway I can do. Are you happy with
Because
that?
they're going to delay my MRI, and if you give me
I
the MRI
can't-
referral, then it
Yeah,
will speed up
I
the process
can't-
for me.
I can't sort of arrange anything faster than this for you.
No,
I will
do
put
you-
on
do
your
what you can.
notes.
I'll
I'll
leave it
put
there.
on your notes to say that you're keen on getting an urgent MRI
Mhm.
as a first thing when you see them.
Of the abdomen and pelvis.
Yeah.
And if you can arrange the blood test ASAP, my blood test is enough with just only the blood test is enough to reveal my conditions and everything that's happened to me. So
So you've had some blood tests not too long ago. That was
it's
okay.
all lies. Like I said, it's a
So I'm
massive
going to be
conspiracy.
referring you to the same lab, unfortunately, where Loxwood Polyclinic has sent to the same lab. It's the same lab that will take the blood tests.
And
and
it's
process
that
it for
same
you.
lab that is.
You want still to, the bloods to go to the same lab?
No, I want to change the lab, and I want them, done
So
properly as it should.
I won't have that option to send you to a different lab.
I mean, do what you can. It's up to them to provide me with the real scans and real results, and we'll leave it there.
For the blood tests,
From my end, I will share the evidence that I've got, so you and your team is clued up on these realities, and you'll see what I'm saying.
so what particular blood test are you looking for?
Detailed as you can possibly do, so it can give them no excuses on getting to the bottom of my true conditions. Because for them, they look for any excuse.
Yeah, so there are certain tests that were done in February, and you will not be due for another year, because these tests are done on an annual basis. They don't change within 3 months, so there's no point in doing all of those. Your diabetes check was normal, your iron levels are normal, your B12, which is a vitamin, was normal, your folic acid levels were low, so we can repeat that check. Can do the renal function test because of the kidney concerns, even though those were all normal. Your liver function test, I know you've been told is fatty liver, that your test levels were normal. Cholesterol was okay, so that's not due another year. Infection markers were normal, and your calcium level was normal, and your blood counts. You can repeat those to make sure there's no urine infection. So we do that test. Is that okay?
Yeah, but whichever you think you can possibly
So where
manage
are you
it,
going to do these
knowing
tests
what you have
then?
found out yourself,
Yeah.
and yeah. I mean, as a community and as medical professionals, the things I'm gonna share with you, like the evidence, we should get to the bottom of this and how they get away with, you know, altering blood test results, MRIs, and make sure that they don't get away with doing this to anyone vulnerable. Because the things I've suffered with, I've already created a path for people to understand these realities and simplified it as much as possible. And the rest is, you know, all the burden's been on me to making sure, go here, go do this, go to another country for medical checkup. Yeah, it's just been hell.
So I'm going to send you a link on your phone to book a blood test and send you the form. Attached to this as well. Okay?
Possible to do it today?
You can check that online.
I'm on an empty stomach, so
No, so we wouldn't be able to bleed you here today. So I can give you the form and the
I'll check for the
website.
dates and then
Yeah,
I'll sort
the
that.
website will be able to. There are multiple clinics and other appointment slots. I'm going to ask reception to give you a red top bottle, and if you transfer this urine in that bottle, we'll send it off to the lab for the infection check. Just get on the couch. And I'll have to put you. Do you take any painkillers for this pain?
No, I've managed to stay strong enough to, you know, continue going as I am. Like I said, I have to wear a chest strap all day.
Yeah, we've got the physiotherapy team here. If it is muscular pain, they will be able to assess you.
And you'll see how,
Because
if
even
you listen
though
out.
you feel your reports previously have not been accurate, you don't believe them, if there is no problem with the abdomen and the liver and the kidneys and you're still in pain, it could be muscle pain. So if that needs to be investigated.
No, I assure you with what I'm living with
Okay,
is
you like
internal organ damage, and you see for yourself. Well,
yeah, it's just like okay. So if you lift your shirt up. Just relax now. Nice deep breaths. Don't hold it too tight. Just relax. Nice deep breath in. And let go. And again. Let go. One deep breath in. And let go.
This is where I get the pains in the
Okay.
back.
Higher up.
Yeah,
Okay.
higher up.
You
And
sit up.
for the kidneys at the
Sit up. I'm just going to sit to your chest.
and continuous noises
Take deep breath in.
whenever I'm movement.
And out. And again. And out. You just try and bend down to touch your toes. Bring it straight.
Like from
Yeah,
here?
yeah, and bend down. Does it hurt when you do that?
Yeah.
Okay, that's fine. We can get all that out. And have you tried doing some stretch exercises or painkillers?
Nah, just like I said, with me just managing to go to work and that's like a whole gym exercise. I take it as an achievement to be able to make it.
Okay. Right. So if you make your way to reception, I'm going to ask them to give you a red top bottle, and you can transfer this urine sample on there. We'll send it off to the lab. They'll give you a printout of urine test form as well.
Sure. And is it possible for you to print out today's consultation and the report from your end?
We don't usually print it out. You have access to your records, and you'll be able to see the consultation.
Got it. And that's it from your end?
Yeah.
Perfect. So I'll just quickly share the video so you can understand how the process of medical fabrication and what I'm saying, so you're a bit more clued up and we can help.
I'm familiar with that concept, but it's everyone's belief. As a healthcare professional, we just need to follow our dues and protocols, irrespective of what's out there on the social media platform. So I probably will look at that in my own time.
Oh, do you want me to share it with you? I mean, it will be very beneficial and you'll understand it clearer because it's the only one on the internet that I've managed to do it in a way where you can also help others that have been, if you ever come across it.
So if you just grab this, I will get them to print that. for you.
If you open Google, so I can share that with you, so you can see for yourself.
I might just have to look at it on the phone because we're not allowed to go on certain websites on Google.
Sure. Are you okay, bro? Where do you want me to do this?
What's the name?
Sharjeel.
Just leave it in there and then put inside the blue bag, please. Just the red bottle, yeah? Oh, you haven't got a label on there either.
No, no label. And can you book blood test from here? Because I need the blood test form as well. That's been requested from me.
Just stick this on the red bottle.
Anything earlier?
That would be the earliest tomorrow. I think we can do it early on Thursday. What time will we do on Thursday? We have around 9:40 on Thursday.
Let's do tomorrow at 12.
Tomorrow at 12, yeah?
Yep. So with the blood test, do I get a blood test form from here now?
Sorry?
Blood test form.
You don't need the blood test form. You just come in.
Here.
Yeah, just come in over here for your appointment tomorrow, 12 o'clock.
12 a.m. 24th of June.
12 p.m. tomorrow, yeah? Or 5 minutes past 12.
Got it. All good?
Tomorrow.
All good for now?
All good for now.
Okay, thank you.
See ya. I did see that anyway. Yeah.
Hi everyone, today is the 24th of June 2026. I am back here at Ilford Medical Centre. Today I'll be getting a blood test done here, which was booked by my GP yesterday, as they have found blood in urine once again and said they will send me in further investigation. I did request for a urgent MRI of the abdomen and pelvis and a blood test, but they found another excuse to send me to a urology department and they will sort it out, blah blah blah. But for now they have agreed to do a blood test, which I've managed to book in for today. With the NHS, I will soon be travelling to Istanbul for a medical checkup. I have already looked at different packages from different hospitals. I've decided which one I want to go with, and fingers crossed I will get honest scanning and results from their end. And if the NHS don't give it, you know how big this conspiracy is and how much suffering I've had to endure and continue fighting. But for now, let's go in and see. Let's go and get this blood test done and see where it goes.
The doctor's got a date, that's what I told you. So you need to wait. You've got 2 more. 2 more. You have an appointment?
Yeah, I've got a blood test appointment today.
What time is the appointment?
At 12,
What's your name?
Shajil Rahman.
Take a seat, please.
What's the name?
Shajil Rahman,
Date of birth?
170199. Bro, can you print out one form for me to know which test I'm doing? Because I didn't get the blood test form.
Yeah, you can take a picture of it.
Yep, that's fine. Okay, thank you, bro. And bro, can you give me my blood in one bottle for me to keep? I want to keep it, please.
No,
Please, by yourself.
this not at all.
Hey, please, man.
No,
Allowed, man. I got it last time.
no, this not at all. If anybody give this is he did a mistake or he did trouble.
No, you know what? They lie about my blood test results, so I have to keep one for myself. Normally, how can I get blood if I'm not a doctor to get needles? You know what I'm saying? So I got no blood left, man. Which lab is it gonna go to?
King George.
Very evil. You gonna take an extra bottle for them?
For what?
So just give them an extra bottle, no problem.
No, it's not allowed. It's managerially allowed. That's what I do.
Okay. Perfect. Thank you, Faisal.
Thank you.
That's all done. I can go home.
Yeah. Thank you. If it is, keep on going.
Perfect, man. Thank you.
Thank
You
you.
have a nice day. It's nice in here.
This is on.
Should have given me extra bottle, man.
Sorry.
Probably good praise for me. Take it.